everyone. My name is Jesse Chason with Lisa Blanchard as the host of Airing Addiction.
I share often my journey started on this campus. Got sober as a client here, just like you.
I really do see phenomenal change.
Always hope. I've seen situations that on the surface look impossible become possible.
Doing this podcast is to share those recovery stories, be honest about what the challenges are and have some real conversations, but kind of share that out on the airwaves.
Welcome, everybody, to Airing Addiction. Welcome to Recovery Month. I am Jesse Chason. I'm truly honored and blessed to be a co-host on this podcast now for some time. And Recovery Month is really a celebration, a time to highlight all the advocacy work that has been done and is being done, all the training. We'll certainly talk about that today, and just all the recovery stories to really celebrate Recovery Month in its many forms and facets. So if you're listening live, we're at the beginning of September. Just as a reminder, we're going to put out an episode each week, as we always do every year for Recovery Month. So please come on back next week, and we'll have another episode. Today, this is a good episode. I said excited. I always say excited, but I've had the pleasure of working alongside this person for some time now, and she's really going to bring a lot to this podcast and to everyone who listens. So I will hand it over to Lisa to introduce our guest today.
Thanks so much, Jesse. Yes, Recovery Month. It's week one. So just, as Jesse said, we do weekly episodes. And what we've tried to do the last couple of years is at the federal level for National Recovery Month, there are these themes for each week. And we've tried to align our podcast episode just because why not? It's fun to match those themes. And this week's theme is health. And I really think one of the things that's really vital to health is education. So I am sitting here and Rachel is sitting here together, but separately at the Cape Cod Symposium of Addictive Disorders. And so that is a really long-standing addiction treatment conference that's held here on Cape Cod in Hyannis, Massachusetts, bringing folks kind of locally and nationally to this space to really provide kind of up-to-the-minute education about what is happening in addiction. And so we thought it was kind of the perfect opportunity to have our guest on. We were just talking before we went live that we can't believe that Rachel has not been on the podcast before. This probably will not be her last time. But with us today, we have Rachel Sasseville, and I have the pleasure of working with her as our Director of Corporate Training at Spectrum and New England Recovery Center, where she oversees all things training, right? So training of our own staff, development of our staff, also external training, right? Training, other providers, right? Providers who don't have addiction specialty, providers who do, who could use some specialized training that we can provide, even communities and family members, right? We've done a lot of community education, and all of that education really does help us support those living with addiction, working towards recovery, living in recovery, kind of have that whole person health perspective. So with that, Rachel, we're really happy to have you here. Do you want to share a little bit about kind of how you got into this field? And then how did that progress into you having a focus on training and education?
Yeah, thank you so much for having me. Yes, this is my first time. I'm a big fan of the pod.
Symposium of Addictive Disorders.
And this
so
is my first time at the Cape Cod Symposium, oddly enough. I've been working in this field for several years. And so I'm glad that I made the drive from Central Mass over here to the lovely Cape. This has just been so much fun already, and we've got a few more days to go here. So thanks for having me. So I have been in this role as the Director of Corporate Training for about 3.5 years. And I'm in my 10th year at Spectrum, having had a clinician role in the beginning and then a clinical program director role in one of our opioid treatment programs. And so I've been around the block a little bit. If we kind of think back to sort of how I made it this way toward training, I always want to be a helper, right? And I didn't know exactly what that might look like, but I found myself very early on after graduating with my bachelor's degree, working in the recovery field. My first job out of college was at a domestic violence program, the LICSW in Central Massachusetts, where really my primary role was to support domestic violence survivors who were working on their recovery. So this was a grant that the YWCA had, probably from, now that I have a little more knowledge, like probably from BSAS or some state funding. And I found myself, wide-eyed, excited to learn about this particular field. I found myself going to detox programs, residential programs, one of them being the Spectrum Women and Children's program, which is no longer around, but I happened to be on the campus. This was 15 plus years ago now, running groups and supporting women who were working on their recovery and also working on, building healthy relationships. Obviously, the link there is if we can support both, right, they're going to have better chances not only of, being in a healthier relationship or finding their way out of a domestic violence situation, also better chances at recovery, long-term success. So I loved that work. I love doing direct service work. I still very much do. But, when I have always, after getting my master's degree and, becoming a master's level clinician, I had always thought, I have this little part of my brain that says, how can we make programs better? How can we make people feel more confident in the work that they do? How can we make clients and patients and the people that we serve have better outcomes, whether it be through different operations, right? Quality improvement. And certainly maybe there's a piece of that goes with training, of course. And so, when this role came up at Spectrum, I jumped on it very excitedly, right, Lisa? And we've kind of hit the ground running. So, this has what I really consider to be my dream job, where I get to support this wonderful organization. I get to support my community, not only my work community, but I live in Worcester. I, work minutes away from my home. And so I feel that I'm supporting my neighbors and my friends and supporting my generation that has been, caught in this epidemic. And so it feels really rewarding to me to do this work that I do. I always say that, of course, I'm not anymore in a direct, I still have patients, I do some direct service work for sure, but, my everyday role is supporting our staff to feel that confidence and that competence. And really my allegiance, so to speak, lies with the patient. Through the work that I do in training and clinical development, I can better support patients on maybe even a broader level than if I were doing that individual work every day. So it's just so exciting and rewarding to me to do this work.
I love that because, I always say, I too, still see people, I can't get away from the direct service, right? I'm a therapist first, but, in kind of progressively higher clinical development roles, that macro change is possible. So one-on-one, you can make incremental supportive change alongside the person that you're supporting, right? They're doing the work, you're supporting them through that work, and you see that individual change. When you support clinicians, you're supporting their whole caseload. When you support a whole program, you're supporting all of the clients and patients in that program, right? When you're supporting a community, it just gets bigger and bigger, and that ripple effect gets much bigger over time, right? So I totally get that.
Yeah.
And Rachel, I've had the pleasure of taking numerous trainings that you have designed and facilitated and co-facilitated and led. But I'm just thinking of the person who's listening to this and maybe is thinking, what's the point? You go through all this school. Don't you have enough school? What's the point of continuing on? Why the Cape Cod Symposium? Why director of corporate training? Like, isn't there like a limit to this? So what would you say to that person?
Well, it's interesting because I think you bring up, if we can like tie this into maybe two different boxes here, right? Is when we think about workforce development, right? Oddly enough, but maybe not so oddly, we are often getting folks coming to work for us, of course, broadly in this field, who may not know a lot about addiction and recovery and best practices and most effective treatments. Folks are often hitting the ground running. And that goes really through every type of job in this field. And so, we, for example, we here on this call are master's level clinicians, and I would be very surprised if you took more than maybe 1 or 2 classes specifically on addiction in your master's program. Certainly in a bachelor's program, it's going to be, much less common to really do any work on addiction. And so unless you're really seeking out that particular education, you're going to be starting really from the ground up when working in this field. So it's incredibly important for us to train the workforce, of course, to ensure that our people know policies and procedures and all that fun stuff. They know best practices. They can feel confident, and to know our philosophies on recovery-oriented care, on person-centered care, the way in which we carry out these modalities and these operations. A lot of that really does fall on us. It's really, we can't assume that people are going to know how to do this job, right? And we're delighted to take them under our wing and ensure they know how to do it. And then when it comes to, this continuing education piece, what we know, and I say this a lot in the trainings that I do, we have seen so much change within the past, you could say even in the past year or two, like sort of a post-COVID world, at how quickly trends change around substance use, addiction. We can think about things like, xylazine that we weren't talking about 5 years ago, other, counterfeit pills and other contaminated substances, an increase in polysubstance use, an increase in alcohol use, sort of post-COVID. We have to sort of stay abreast of what's going on so that we can better inform our patients, and we ourselves are better informed as to the best practices and emerging practices in the field. And so, what we were doing in the field 15 years ago when I was running groups in those detox programs from the LICSW, we're talking about different things than we used to, and we know better as well. So yeah, we have to do both, right? We have to train the workforce, and then we have to keep training the workforce. This is just not going to end. We have to really keep growing.
That's such a good point, right? So, being at Spectrum for 26 years, right, which I try not to say out loud too often, right, because then I have to
well, you started when you were 18, Lisa.
Yes,
so.
Yes,
like,
right.
The older I get, the younger I get when I started. But, there really has been a significant shift, right? And there's some things that are really still fundamentals, right? Like some basic RAPS prevention skills. Those are probably always going to be useful, right? Like those aren't unhelpful, right? It's not that we had everything wrong, but it's that, we've really learned more. We've learned more about the brain, right? We've learned more about the impact of trauma. We've learned more about, the significant, impact of, co-occurring disorders, right? And so, years and years ago, there was like this idea that you either had to, I just had this conversation over dinner last night, right? That like you had to, treat the underlying mental health first, then the addiction. Oh no, you have to help somebody reach abstinence, and then we can work on your mental health. And, we've just learned so much about that, really being so connected now that it changes how we do care. And so when we learn more, we have to then adjust our services, and we have to train people on those emerging kind of best practices, on those differences that we see from kind of way back when. And we're also seeing this real shift. And you did a really nice job of adding this to your, intro part, is like, we need to involve the person that we serve in this conversation, right? It's not the same thing as cancer treatment, where there's clinical trials happening in labs, in research spaces, that, you make those decisions and then you present those options, right? Like, we have some of that. We have a lot of evidence-based, for things like medication for addiction treatment that we have to share, but we also learn a lot from those that we are trying to support, right? And so I wonder if it would be helpful to talk a little bit about how we involve the voice of lived experience in our training and evolution.
Oh, well, that's an interesting point. So, I mean, I guess what is coming to my mind first and foremost, because it's just so topical, something we've been working on, of course, is we have recently at Spectrum begun implementing recovery coaches within our opioid treatment programs. And, many of those watching and listening might know that recovery coaches are, non-clinical roles for folks working in this field, certain certification, accreditation for this, where they're really leaning on their lived experience and supporting clients, or what we might call recoveries, in support, resources, hope, encouragement, and we see that this is so incredibly important to train on for everybody, right? For peer workers and recovery coaches specifically, for clinical staff to understand that role as well. We want to make sure that we are hearing from those with lived experience. And that's just one way that we do that here at Spectrum. Of course, at Spectrum, we have a peer recovery division with peer recovery support, several peer recovery support centers. And they're at the table with us. And they're training, and we're learning from them as well. And so we, as clinical professionals, we absolutely welcome and really need that guidance to ensure that we're providing the person-centered care that our patients need.
Yep.
So that's what comes to my mind a little bit.
That's a great example, right? Because, there was a time when that wasn't necessarily the case in formal treatment, right? It was very separate, right? And so there was mutual support groups, which were led by lived experience, and there was treatment, and those didn't necessarily connect to each other. And we have a lot to learn from each other in a really multiple pathways approach. And, it makes me think about the term that will come up a lot. And I think week 3 of the Recovery Month podcast, and we have Michael Arillo, our director for Everyday Miracles in Worcester, right? But that concept of nothing about us without us. And that's part of inherent what we do in this podcast, right? Like I don't just say, you know what, I'm a chief clinical officer, I could just run this podcast, it's totally fine. I don't think it would be good, honestly, right? I want to make sure that there's that balanced perspective of lived experience. Now, of course, Jessie gets to wear both hats and so brings value in multiple ways. But one of those
How do you fit both hats on your head, Jessie?
I have a big head, Rachel. I have a big head. But to Lisa's point, having a foot in both worlds, in the mutual support group and in the clinical role, even before, being a master's level clinician, multiple other roles, and in even someone who, if you've been listening to this podcast for a while, I think it's even in the intro, my story started here at Spectrum as a patient. So having a foot in both of those worlds, formal treatment and mutual aid, oftentimes I would see that, we're like on the same page, but we're just not connecting. Right. And whether that be, different views on what the goals of recovery are, different views of what abstinence looks like, different views of how to get from point A to point B. This has been kicking around in my brain for a long time and might be the subject of a doctorate program someday, to really boil down these two differences, having a foot in both of these worlds, and how we can come together and work together. Because in my experience, that leads to the best outcomes. Rachel, you were talking about the best outcomes, on a micro level, one-on-one, and on a macro level, supporting programs and being that helper. And really, I look to your role as a helper's helper. Because you're meeting with people one-on-one, but you're also supporting all of us with these trainings and the community with education. So that's just what I think about when I think about lived experience and how it can fit in, not a part of, not separate from, nothing's better than. It's an all hands on deck approach.
Yes, absolutely. Really good point. And it's part of we have to collaborate. We should collaborate. It's going to provide better outcomes for people, peers and clinicians, peer workers, recovery coaches, clinicians. We might walk different paths, but we're going toward the same mission, right? We're going to, converge every now and again, but in some ways we have parallel lanes, but we want to ensure that we're both there working together for the needs of that patient.
Yeah.
I wonder if we talk a little bit about the ways that education supports reducing stigma.
Yeah. So it's probably like, if I could just, give people one takeaway. I think this, for our workforce, it's understanding how stigma can permeate everything that not only our patients experience, but how it impacts their systems of care. And to really understand that on a human level is just so, so crucial. And so if we can educate our staff about how to combat stigma in really, practical but important ways, we know that that's going to, of course, have our patients feel more supported and, maybe on a larger level, keep moving along to sort of end this stigma. And, one really big thing that we talk about so much, and I just am always talking about recovery-oriented care and recovery-oriented language that we use. Words matter, right? Yeah. Again, people may not know that, right? Our staff may not know that, and that's okay. We're here to help them ensure that they have the right language, they have the right understanding of how we talk to patients about substance use disorders and addiction and recovery, but not only to them, but how we talk about them. I often say, how we talk about our patients when the doors are closed and we're in team meetings is just as important, maybe even more important, than talking to our patients. And so that's just one thing that we can do when it comes to, ending stigma and providing that recovery-oriented care. And, another piece when it comes to stigma is understanding really the multiple pathways to recovery. Again, recovery is just not one size fits all. And, we have many staff members who have lived experience, who may be in recovery, who they know their pathway, right? Which is great. And then we want to zoom out a bit, right? We want folks to understand the many pathways. And then for folks who may not have lived experience or may not have a ton of education on the topic, they might think of, hey, here's the one pathway. They go to detox, then they go to this place, then they go to that place, and then they go to 90 meetings in 90 days, yada, 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 what's in sort of the popular culture. But there are so many pathways to recovery, and recovery-oriented care is being judgment-free about that, being excited to support the people that we serve with finding the pathway that they feel, gets them excited the most about recovery, and that it can also be many different pathways, right? It's not just medications for addiction treatment. If you're on MAT, you can't go to this place, right? You can't go to AA. No, we can combine these things. We can join forces and find what works for you. And so, a big piece of training is understanding how all of these things can really intersect and make a difference. This is going to be individualized. And that's definitely part of stigma.
Yeah, that's all education, right? In order for people to understand that there are multiple pathways, one, that's education, that concept alone, and then what those might be, and that there's actually infinite pathways. Like there's like, more, like I always say, it's more than multiple, it's really infinite, but like that really kind of education about what all of those things might be, so that when you're supporting someone, you have like a whole list and menu to be like, you try the things that work for you. Here's the things that some others have done. Here's some evidence base, right? Like you would when somebody comes to you with, and you're meeting with a team of doctors, embarking on cancer treatment, you're going to be like, here's the evidence base. Here's the whole person stuff that might be helpful. What do you think you want to do, right? Like we don't do that enough in treatment. And it really takes education to even help people understand what all of those pathways might be and what might be options they could present for someone to try for themselves. And, just a bit of a shout out, right? I'm really glad that you brought up language, in person first language, as part of that stigma reducing opportunity. One of our, I think, first year podcasts was with Dr. Miriam Komaromi at Boston Medical Center and Julie Burns at the Rise Foundation, where we spent an entire podcast just talking about what language do we need to change, right? And that was really an educational activity. We did that podcast to educate the general public about why it matters, right? And what words might we want to shift a bit, and why that has an impact. in reducing stigma, in how somebody feels about themselves, how somebody feels about their family member, how we feel about those that are, in our community, that it really does have a huge impact. And so we often start all of our trainings with like a little reminder about language, because language is something that evolves over time. So back to kind of your earlier point about like this continuous need to evolve as a field and continue to be on the forefront of trends and what's changing. Language is one of those, right? There's probably going to be language shifts, things that we say now that in 5-10 years, we will be like, you know what, there's a better way to say that.
Of course. Gonna update those
improvement.
flyers and update those PowerPoints once again, but it's worth doing.
Yeah, constant improvement and constant learning from everybody at the table. And Rachel, I love how you said that there's no one size fits all approach. I often say that too. It's not cookie cutter recovery. It's really what's individualized. And yeah, it is in a lot of ways infinite, because it's, it's like you can add a little bit of this and a little bit of this. And I do find great comfort in the fact that I can hopefully be in recovery for the rest of my life and still not exhaust all the resources at my disposal, because there's just that much out there, whether it be groups, whether it be programs, whether it be initiatives, whether it be advocacy work, education, things that reduce stigma and reduce barriers. There's just so much out there to be involved with and a part of. And also kind of to that point, and maybe a little bit of a selfish question, because I've always thought this in the back of my head, being infinite pathways and being no one size fits all cookie cutter approach, how do you determine what to train on, what subjects to bring to the larger audience, whether it be in-house here at Spectrum or in the larger community?
Well, that's a really good question. And I don't, there's no magic here. I don't necessarily think, I think there are certainly some foundations that we, want to make sure that, certainly our workforce understands, as well as the community, as needed. But things like recovery-oriented care, person-centered care, some practical strategies and resources for finding that particular pathway. Different staff need different things, of course, right? So that's of course important, but when we think about training sort of our staff at large, perhaps, our wonderful, front desk coordinators, like they might not need to know how to do a treatment plan or, sort of the ins and outs, but they do need to know why we have the care that we have, and those foundations, right? So, we start with the foundations, and then, we also really continue, when it comes to internally. And I think we've done a great job in the past few years, really focusing on this clinical development piece. And so we've, I can plug Spectrum Educational Institute. We run a lot of really wonderful trainings throughout the year that are accredited, through various continuing education accreditors for our staff members. So it's a really great perk for Spectrum staff members who have those licensures or certifications. And, we hear from our staff, how we choose the trainings that we do is really coming from staff input, right? What are they writing down in evaluations that they're interested and excited about learning about? We also see challenges in our field day to day. And, we brought up earlier this real kind of surge in alcohol use disorder and the amount of folks that we're seeing, particularly in inpatient, who are coming really with a primary diagnosis of alcohol use disorder, maybe different than what it was 5-10 years ago. And that means in response, we need to train our staff a bit more about that, right? And so we have to be flexible. If we just did the same 6 trainings every year, that's boring, right? That doesn't encourage folks to come in. But if we can ensure that we're giving, the stuff that feels really relevant to our staff, they're going to be more excited, and it's going to be a bigger impact for our patients as well. And, you mentioned community work, and, Spectrum has done work around community education. We often see a need, really in all different areas, right? People with substance use disorders live everywhere, go everywhere. This is the community. And so we want to ensure that different types of communities have the information that they need. And so we can do conversations in schools, and we have around perhaps substance use prevention and sort of early intervention. We can do work with, overdose prevention and Narcan trainings. We have recently, I just had a ball going to a group private practice to share with clinicians who maybe it's not their bread and butter like it is for us to work with people with substance use disorders. But man, oh man, do people have maybe secondary substance use disorder, alcohol use disorder? We know how prevalent it is. And to really understand how to spot that and assess it, bring it up with kindness and compassion, non-stigmatizing way, and so that they too can be supported with that. And so it's all about sort of who needs what. And we are just happy to do it all.
And that's such a good point, right? Because there's been this historic split between mental health treatment providers, or, I treat this population. Oh, I don't do addiction.
Sure.
Right. And that's been one, like both kind of, I do addiction, I don't do mental health. And mental health, I don't do addiction has been one of the things I have been combating for the past 26 years, because it's all connected. And if we just say, you know what, you might need to do that somewhere else, that actually perpetuates stigma, right? If we say, like, I can't help you with that, I don't have the expertise. And of course, people need to learn some things about it, right? They need to understand more, maybe build some motivational interviewing skills and some skills that will help them intervene better. But we need to, in order to help the broader population, we need to be able to intervene at all points. And so I love this direction that we've been going in and thinking about how do we, as the provider for over 55 years with tons of experience in addiction and the consistent evolving practice, staying on the forefront about what is evidence-based, what are emerging practices, how do we need to shift, right? The more we do that, the better then we can train other providers, right? So we do quite a bit of training, and I'll let you speak more to it, to, maybe child-facing providers, primary mental health providers, that group private practice you referenced, right? Yeah. And invariably we get like that makes so much more sense now. And it does 2 things. It breaks down that stigma about addiction, and it reduces that fear that I can't be a helper here.
Sure. Yeah. And it's sort of I think too, again, we want people to feel confident, competent, understanding, stigma. We want to also kind of demystify it a bit, right? We want to demystify treatment. We want people to be open about these conversations, because we also know that addiction just, what do they say? It sort of like breeds in the silence and the stigma. And so if we can just
lives in the shadows.
Yeah. And so if we can just say, like, yeah, probably if we're thinking about substance use disorders at large, I don't know, 20% of your patients with anxiety, depression, something else, well, they probably maybe have some problematic substance use too. And hey, let's ask about that. Let's normalize that. We think about, can you, there are great screeners, an audit, different screeners for alcohol use disorder, cannabis use, substance use in general. Ask that upon it. It doesn't matter what somebody's coming to treatment for. Screen for substance use, right? It's 5 questions, 10 questions, and it's going to give you such a bigger picture, perhaps, that might save somebody, years of treatment, if we kind of nip it. So yeah, it's, different communities need different things, and we're just glad to do it.
Yeah. And you're exactly right, Rachel. Might save someone years of treatment, always focused on the patient. But as we're talking about education and as we're talking about training here, also for any providers that are listening, could save a provider years of just treating symptoms without actually getting to the root cause, right? Because I don't know about anyone else that's listening to this podcast, but I thought I was really good at hiding my illicit substance use, and maybe sometimes I was, and maybe sometimes I wasn't. But I know I've been to providers before, and inevitably when those questions come up, oh, how much do you drink? Not that much, 2 drinks, right? Or come up with some white lie that really just minimizes it, and then you're right. Part of that fear, that living in the shadows, is that person, that provider, is going to take that answer and not really ask anything else, not go deeper, when just below the surface, there's been many times where I've sat in a provider's chair and I've wanted to go deeper, or I've maybe without even realizing it, I'm thinking of one, even before I came to Spectrum, where I longed to just get out of the cycle that I was in, but that provider, for maybe legitimate reasons, was there to help me with housing and not with substance use. So stuck to that lane, and I went on my merry way. Right. So just below the surface there might be great breakthrough with the right questions, with the right training, with the right confidence and competence in the skill.
Right. And that education reduces that judgment, right? So the conversation won't be like, let me just read this screener, and by the way, I'm reading it, you can tell I want you to say no.
Right.
You don't drink, right?
You don't drink or do drugs, right?
Sometimes with anxiety, it's really like a common coping skill to use some substances to try to manage that. And that makes so much sense to me. So I'm going to ask you some question about substances, and that we'll talk about that. That feels really different than all right, now I got to ask you some substance use questions.
Right.
And then you just ask them and you move on, right? And you don't ever talk about it again. But education really supports that integration of that work, right? So how would folks connect with us about how to get kind of, training and technical assistance if they themselves are interested in attending training, if their practices, if their organization might be how do people connect to you?
Well, sure. Well, I'm just one click away. You can certainly go to the spectrumhealthsystems.org, and there's a little tab for training there with my name and email address there. We are more than happy to customize trainings to the needs of your staff, your community, whatever it is that you're working on and working with. We are more than happy to help. We also have a mailing list where we can send out some information about upcoming trainings that we can provide externally. So yes, just do feel free to reach out. We are it's the really exciting part of what we do. We're excited to grow here.
And I wonder if we could talk a little bit about kind of the current kind of, big external project that we've been doing for some time in the Echo series that we're doing for correctional treatment.
Yeah, that's a great point. So Spectrum has been the contracted provider of medications for opioid use disorder within Massachusetts Department of Corrections since 2020, I believe. And we really have done a great job implementing opioid treatment within jails and prisons throughout Massachusetts. And we, had a kind of a drive to share that knowledge. We know that this is something really throughout the country that's happening in response to, different legislation and, an obvious need for treatment within correctional environments. And so we thought a great way of doing that was through Echo. And so feel free to look up Echo, but Echo is a model, sort of a learning model that began at the University of New Mexico, sort of pre-Zoom era, where really the idea here was to utilize technology and telecommunications to kind of get subject matter experts kind of in the virtual rooms with folks who might need that, who maybe don't have that specialty, particularly more underserved or rural areas who might not have, the top docs in their area. And so this has really grown. Echo has grown. It's global. There are probably, I don't know, you can fact check me, but hundreds of Echo hubs throughout the country and throughout the world. And we went through the process of becoming an Echo hub last year. And we thought we would start with this correctional MAT trainings. And so we provide a once monthly Echo series. Each Echo session has a didactic presentation with a subject matter expert, and then followed by a case presentation. So it's really case-based learning. It's, we have a de-identified patient. Participants can come and share any struggles or challenges that they're having in implementing or supporting patients on MOUD within corrections, and they get that sort of real-time support. So we're kind of all teaching and all learning from one another within that series. And so we do a lot of work and education around correctional substance use treatment. And so another thing that we can kind of tailor some trainings to. And we also have information on that Echo series on our website, spectrumhealthsystems.org.
Great. Such a great example of not just keeping knowledge to ourselves, right? So it's not, and I coach this nationally, so it's not an easy feat to implement medication programs in correctional settings. It's just not.
Yeah.
And so there's logistical barriers, there's security challenges, there's lots of stigma, there's lots of reasons why this is challenging work to do. And even with really well-intentioned systems, it's helpful to learn from others who have done this work, right? And so that's part of why we really feel strongly and why you're doing such an amazing job as kind of the face of our training, is that we don't want to keep things to ourselves, right? Like that macro change. We don't want to just run good programs, support those that we care for. Of course, we want to do that, right? We want to then spread that out to others. And that's what training and education really can do.
And see, Lisa, we've been co-hosting this for however many years now, and oftentimes we're on the same page. And you just read my mind, because my last question to our fabulous guest here, I was going to bring back the question that we used to ask all the time at the end, to not keep this knowledge to ourselves. It's not a trick question, Rachel, don't worry. We used to ask our guests, for a resource recommendation. And I thought, what better guest to ask than someone who is up on all the latest and greatest with trainings and psycho ed. So, if there's any book that particularly, floats your boat these days, or podcast or show or whatnot, just to share with our audience that's maybe looking for another resource.
Oh my gosh. Besides airing addiction, I just listen to, really murder podcasts and things like that. So you don't want to.
So podcast is out. People. Yeah.
But yeah, I don't know. I'm trying to think what I'm reading right now. Oh, well, I'm reading about acceptance and commitment therapy, which has been sort of my new jam lately, in the work that I've been doing. But and I bet this has been recommended, but Beyond Addiction is a great book to get started with. So, that's another thing to think about, but yeah, just get the knowledge. And if you want to know more, you can ask us, and we're happy to chat about it.
Resource, right? So right yeah. The website with the training page, and that is our
that'll
resource.
do.
All right. Well, this has been such a great conversation. I'm sure we'll have you back, right? Because you're in this space of sharing your knowledge and what you learn out, with the broader community. That's exactly what we're doing on Airing Addiction. So I'm really looking forward to future conversations, looking forward to spending the rest of the Cape Cod Symposium with you. Wish you were here with us, Jessie.
Yeah.
But we will all see you back next week, right? We've got an episode a week, and we'll be sharing that out. So look at the New England Recovery Facebook page, look for the social media, or just follow the pod, and you'll get those episodes as they come up. And we look forward to continuing to celebrate Recovery Month with you all.
Yes, we do. Thanks so much, Rachel, for being our guest today. Thank you, everybody. We'll see you next week.
Thank you.
Bye.